My first guest is Dr. Hope Cottrill. I'm going to try to get this out here. You are a gynecological oncologist, right?
Yep, gynecologic oncologist. That's
basically,
right.
female cancer is what you take care of.
Exactly. I say anything from the nipples to the knees. That's the neighborhood that I work in.
Well, since we're going to talk about breast a little later, tell me about some other type of cancers you see. Ovarian, for an example.
So ovarian is known as the silent killer, and that's because the symptoms that women have are symptoms that everybody has all the time, every day. Bloating, change in your bowel function, a little constipation, heartburn, your clothes are fitting tighter than they used to. A lot of people think that they're just getting older and they actually try to diet. But what can happen is the cancer can actually cause a buildup of fluid in the abdominal cavity. And that fluid makes the clothing tighter and tends to give women these symptoms. And unfortunately, most women present with advanced cancer because there's no good way to detect this cancer.
Was there any certain type of patient that's at higher risk for this cancer?
So any woman with a family history of breast or ovarian cancer, particularly early onset breast cancer, that woman may be at increased risk. And that gene is the BRCA gene. So we think about high profile people who are known to have it, like Angelina Jolie. So she made headlines when she underwent risk reducing surgery with mastectomies and having ovaries removed. But those are things that very high risk individuals can do to statistically decrease their risk of disease. In Kentucky, we have a syndrome called Lynch syndrome that also has an increased risk of ovarian cancer as well as endometrial cancer and colorectal cancers and other cancers. So within your family history, if you have early onset cancers, you should bring it to your doctor's attention and perhaps see a genetic counselor or undergo genetic testing.
Is there anything you can do to prevent it?
So screening has not been shown to be effective for ovarian cancer. And actually, the U.S. Preventive Task Force is coming out with revised recommendations against screening with ultrasound and checking for a blood tumor marker called a CA-125. Unfortunately, CA-125 tests can be normal in about 10% of women that have ovarian cancer, and it can be elevated in a variety of non-cancerous conditions, including endometriosis and liver disease. We've been looking at ultrasound screening for a long time within the gynecologic oncology community, and there's ongoing research programs. But it's actually a recommendation that women don't get screened because the likelihood of finding a benign tumor and that woman undergoing a surgical procedure with the risks of surgery being up to 20% as far as complications, that risk does not outweigh the benefit of women undergoing screening. And a lot of that has to do with the patient population, how common this disease is. Only 1.6% of women will get a diagnosis of ovarian cancer. So when you look at the numbers, it actually doesn't save lives for women to undergo ultrasounds or CA-125 testing. What they can do, though, is birth control pills decrease the risk of ovarian cancer. And in some studies, it can be up to 30%. And that has to do partly with how long the woman's on birth control pills. The other thing that has been shown to decrease a woman's risk of ovarian cancer is removing the fallopian tubes. So at the time of surgical sterilization, like a tubal banding, instead of having that banding done, take out the fallopian tube. And that can decrease the risk of ovarian cancer later in life as much as 40%. Now, for those very high-risk individuals who are Lynch syndrome patients or BRCA syndrome patients, they can't have just fallopian tubes removed and that be a risk-reducing procedure for them. And they may be candidates for some screening with ultrasounds, although the data there isn't strong either. Okay. We just don't have anything better.
All right. That's great information about ovarian cancer.